How's it going, everybody? Just a beautiful December 18th. There's still people joining, but because time is limited over a lunch hour, we're just going to have to go ahead and get going. I've got a lot of information to go through. Whoever just joined, if you can mute, please. We'll go through a bunch of information to start, and then there will be a little bit of an activity for everyone to participate in. So we'll dive right into it. Here's the goals for today. We're going to review 2018. I'm going to try and cram a bunch of, as much as I can say about what happened in 2018 in about 25 minutes. So wish me luck on that. And then we're going to get into some brainstorming and goals for 2019. My disclaimer is that there's way more information in these slides than I'm ever going to get through. So these slides will be available to you if you want to go back and look or review it. Anything, they'll be available through your supervisor. Some brief overview, some high-level numbers from 2018. You can see the different locations, the different sites, and what was accomplished at each one of our sites. The blue is the template hours. That's the number of scheduled hours that we were available to see patients. Completed encounters is in orange, and work RVUs, which some of you are familiar with and others are not, is in gray. And you can see the incredible growth we've had, especially at our South Fifth location. And the total number of encounters is just huge. The number of lives that we touch as an organization is very significant. The number of active patients, if you can believe this, we have over 16,000 active primary care patients, and we define active in our system as those seen within the last 3 years. It's highly likely that there's some that we haven't yet seen, such as those, for example, who transferred care from San Juan Family Practice to Cedar Point Health, but they just haven't been seen yet. They're maybe not due for their physical, or they haven't had any health concerns or needs, and so that number is likely to continue to grow. We're, of course, adding a number of new patients every month as well on the primary care side. The data is slightly imperfect. There's flaws that we're teasing out. As an example, Chris Posley has something like 1,700 patients assigned to him in our system. And that's because early on we had a bunch of urgent care patients that were assigned to him rather than our doctor urgent care. And so there's some flaws and some kinks that we're working out. There's also, we must acknowledge, a number of patients that haven't confirmed a transfer internally. So, for example, Dr. Painter recently left us, and a number of her patients have been reassigned within the practice, but despite some effort on our part, we haven't been able to get a hold of them and reassign them internally. So again, there's reason to suggest that these numbers are going to grow and change, but this gives you some broad perspective. Quickly review some of our key foundational concepts. Our mission statement. Our mission is to serve Western Colorado communities by providing high quality, compassionate, comprehensive healthcare to all ages. And it's that mission that drives us forward. I'm not going to go into each of our values, but you can see our 7 identified values that are up here and a brief definition or explanation with each one of them. Some things that I wanted to review as far as accomplishments or things that we've been working on throughout 2018 in our strategic plan. So one of the components of our strategic plan is culture development. And as a sub-bullet of that, we wanted to improve employee morale and loyalty. There's a number of planned efforts that have been put forward, such as our bonus program. We make significant effort to recognize each birthday in our organization. We're aware of work anniversaries. We try and provide lunches. We do meetings. We have improved some of our communication plans. We've put on barbecues. We've been training our supervisors on their responsibilities. There's a lot that's going on. There's also unplanned events, if that's a way of putting it, where we just try and recognize, as our leadership team makes it out to each of the sites, we try and say, hey, I noticed that this happened, or thank you for putting so much effort into this or that, or even just a broad thank you for serving our patients so well. We talk about that concept of Oreo sandwich, right? That's the, if there's a criticism to provide, we hope to sandwich that between two compliments. We also just, Dean's really good at this, especially, but he'll think on the way to one of his sites, he'll think about just grabbing a treat or something to give a boost to that staff that he's off to visit. We talk about some of the behaviors that we need to envelop as an organization, and we talk about that and how that affects our culture and our morale. We've done a lot of things to improve staff development and education. We've, like clockwork, the last several years, we've increased provider CME. My plug for that is that, of course, we want you to use your CME, our providers. That's why it's there. But our physician owners have also been advocates for wanting that to be pre-approved. They want to know what education events you go to, you would like to attend, and they want to be able to understand that and support it. And they also would like you to consider coming back and sharing some of that information with the rest of us. But you can see the other things that we've done to improve some of our staff education and development. One of the other sub goals was develop a system for provider cross coverage. We've put some emphasis on the care teams on the primary care side and how we can support one another and in our care teams. Of course, this is to help hopefully prevent some provider burnout, that when you take time off, that you actually get time off, that somebody has your back and is covering for you in the office. But I am concerned that in some areas we're falling short on that. So there's more to address, no doubt. We wanted to create a plan for physician owner presence and support all of our locations. We thought it was important that each of our owners spend time at all of our sites. And so each of the owners have had the opportunity to take an assignment to be scheduled for a month to go out for visits. And that hasn't been perfect either. And we need to improve on that. Another area of focus has been growth and recruitment. As sub-bullets of that, it was identified that we want to meet the primary care needs of Montrose by recruiting well-trained and qualified providers. We recruited Dr. Lindsay Meredith. We recruited Leslie Gibson and Suzanne Haig. Coming in our future is Eddie Medina and Ryan Whistler. There's also two other candidates that Ashley's been working closely with and that have come out for site visits, and we hope to have them confirmed as members of our team here shortly. So there's been a lot of work that's happened for primary care in Montrose, which is a great thing. As another bullet, it was talked about that we want to reassess the needs for primary care and urgent care in Grand Junction. To be honest, I think our goal there was a little bit derailed by some provider attrition. We lost a couple really great providers that had previously been recruited. And so that created some challenges, and it diverted us from maybe our initial goal. And so instead, our efforts went to replacing providers. And in that light, we're really excited to have Alex, Spencer, and John join us. Also, just make a brief note on provider engagement and support. As we've lost a couple really good providers, for various reasons we acknowledge, but we do believe that we want to be better at provider engagement and support. And so there's a lot of conversation taking place about that ongoing. Excuse me. I'll try and get through a little bit of public relations. So we wanted to have a stronger charitable presence in our communities. You may or may not be aware of some of the events or organizations that we've helped sponsor or make donations to throughout 2018. Girls on the Run, Nurses Day, High School Sports, Montrose Community Foundation, San Juan Healthcare Foundation, Special Olympics, Back the Blue, 5K, Hope West, Bosom Buddies, about $8,500 that have been donated by the organization. We also have put on a couple really big events. There's a lot of people that participated in our haunted house, for example. That was such a fun event and something that everyone that participated is looking forward to doing in the future. As you know, we also have the Giving Tree event that's going right now, and there's a lot of donations that we're accepting from patients and from the community. And so there's been a lot that's been accomplished with our charitable presence in our community and being responsible community members. Again, for the sake of time, I'm going to skip over some of these things, but you can read them and these slides will be available to you. We've done a number of things in another area that we put some focus on, internal process development. So one of those areas was trying to support our providers by creating more templates. And there's been a number of templates that have been created, as well as PE types. And that's another area where it's kind of in progress. That's the one that we're probably not likely to stop doing. And we're ongoing seeking our providers' input and support because we want to help them to be more efficient in their charting. It was also identified, especially for our larger sites, that we wanted to improve how incoming phone calls were handled. And so a call center has been developed and implemented for our South Fifth and Nevada locations. And we have some really great team members on board helping us. That's Candace, Tiffany, and Sarah. Thank you so much for your hard work and all that you've invested in helping that call center be successful so far. We also wanted to advance our care management. I'm not going to do this justice, but so much work has gone into the work of care management. We've added staff and developed our tools a great deal. We've made significant progress even in the last 30 days. I worked with Chantel, our supervisor of that department. We set a goal to have 100 enrolled chronic care management patients by the end of the year. And I think it's highly likely that we meet that goal. We're at 88 currently, 88 enrollees, most of which have come in the last few months. That's such a reason to celebrate and a success. We've also expanded our transitional care management services to other sites. I may be throwing out terms to some of you, especially on the urgent care side of our business, that are maybe not familiar with you, but our supervisors can help answer some of these questions or get you the answers. But you should know exactly what CCM and TCM means to our organization. Excuse me. We've implemented Greenway at all locations. This was such a huge need for us to all get on the same EHR. I will have to acknowledge what a significant and challenging project this has been. A project that, yes, we're all on the same EHR, but yes, there are still challenges and still issues that we have to work through, but we have to pause to celebrate the progress that's been made. Again, there's a lot of other projects and things that are happening to advance us forward in the area of internal process development. And I just wanted to make you aware of some more of those things. Other things that were identified include our nursing home patients. That's another project that, there just wasn't the resources to invest the time and energy to do much there. So not a lot's happened. We've also talked about expanding services into lab imaging, home health, or maybe some of these other areas. And we realized as we got into that a little bit that there's some significant legal ramifications, and we wanted to make sure that we fully understood those. So even just this morning, our part of our leadership team was on the phone with some of our attorneys who did an audit on our organization to make sure that we're in compliance with Stark, and make sure that we can make steps forward and as far as expanding services confidently and without any legal ramifications. So there is a lot of progress that's been made, though not a lot that has been worth sharing so far, but just know that there is stuff happening. So there is a lot to celebrate. So much has happened in this year, and we want to be able to celebrate that. And we're really excited for what's been organized. Ashley's been putting a significant amount of energy and effort into our annual winter party. We weren't able to schedule this during the month of December like we normally might. And the reason for that is because we don't want to compete with everything that's going on in your lives. Oftentimes when we do it on a Saturday, for example, in December, it's really hard for people to attend. And that's why we put it off after the holidays, and we'd love to see everyone there. It sounds like we already have a big chunk of our employees who have RSVP'd. I think I heard a number close to 200. So that's going to be so fun. We've rented out the entire rec center. There's going to be a lot of fun, great food, and good company. I realize it's late in the evening and there are some challenges with that, but please, it's going to be a great time and a great opportunity for us to celebrate as a team and to function as a team and to get to know one another. So there's a lot to be grateful for, a lot of hard work that's taken place, and I wanted to get that plug for our winter event. And yet we know there's so much more that we can do better. I think everyone in this organization can sense that. We take a great deal of satisfaction knowing that we've done a lot, and yet we should pause to celebrate that. But as we look to the new year, we know that it's a time to recreate goals, to talk about what could be accomplished. And with the duration of the time, that's really what I want us to focus on. And so I'm going to pause here for a little bit, and I'm going to put you on the clock, and I want each of our groups to accomplish these things, and I'll walk you through it. I would like somebody to take the lead, usually our supervisors or whoever feels comfortable, to take the lead on a brainstorm and talk about what you want to see come to fruition in 2019. In a brainstorm, any idea is a good idea. It's about quantity. We want a lot of ideas. So please give input, jot down those ideas. It might be on a whiteboard, it might be on a piece of paper, wherever it's convenient for you at your location. We will end that abruptly at 1:05. At that time, at your sites, each of you will vote. And every member of our team will have 2 votes. So you will have a chance to kind of review all the ideas that have been spat out in the brainstorm and throw your vote in the hat for 2 of those ideas. Again, I'm going to leave it to those sites to figure out exactly how to accomplish that. I would throw out a couple of ideas. That could be, everyone just writing their 2 votes, what they're voting for on a piece of paper, a torn piece of paper, and hand it in. If you're working on a whiteboard, you might go up and put a check mark next to what you voted for, or a sticky note next to what you voted for. You could vote for the same idea twice if you felt strongly about something. We've only got about 5 minutes between 1:05 and 1:10 to get that voting done. So that I say simultaneously is I want everyone to kind of just go vote at once. We don't need to go one at a time and everyone share their thoughts and ideas. It's a little bit chaotic, but it's fun. Just everyone get their vote in. As that occurs, and we get each site should settle on and at least share with me one idea for the idea that received the most votes. And then in the last couple minutes, I'm just going to share with you what I've received. And then we'll hopefully end at no later than 1:20 so that we can get our afternoon started on time. So have at it. You've got 15 minutes for a brainstorm. Just a few more minutes of brainstorming and then we'll move on to votes. All right, we really ought to be wrapping up the brainstorming and consider how we're going to organize the voting system at our location. So consider wrapping up here in just a minute. All right, from what I can see, it looks like there is some voting going on, but you ought to be voting if you haven't been already. Once those votes are in, if you'll text or otherwise send me what your top vote was. All right. I've got a lot of votes here and a lot of great ideas. Pretty exciting. I just wanted to emphasize one thing. We're not voting for one idea just for those are the only ideas that are going to come to fruition. Really, at this point, it's just about what we're going to be sharing. It's important for us to know which ideas are most important to you, so we can escalate those throughout the year. But I just wanted to reassure you also that all your other ideas, we want to know about those as well, even if they didn't get a significant amount of votes. So supervisors and staff, please help make sure that you capture those other ideas with a picture or something, and share that with our leadership team. It's also important for you all to know and feel that you could come and share those ideas at any point. There's power in a group setting, and you can really build some synergy off of each other and develop some great ideas. But excuse me, it isn't necessary to only wait till this time of year to share those ideas. So if you have more ideas, please bring those to our attention. Help us know about those. We want to know more about those. So to share some of the ideas that have come in. The first one that I got was for an on-site pharmacy. The second idea I have on my list is for more PRN hires. It was suggested that they need more backup coverage to be able to comfortably take time off. Another group was an advocate for electronic orders to the hospital, to be able to send those orders electronically. Another team yet was an advocate for an on-site X-ray machine. Obviously one of our urgent cares. Let's see. Another team was an advocate for in-house mental health. I did a poor job of not updating our team, but that's actually something that's in the works. We have approval from our board to hire a licensed clinical social worker, and we're moving forward with on-site support and behavioral health for our providers. Another office was an advocate for an increased amount of local community give back, participating in more community events and charitable opportunities. Another office their idea was for a dedicated MA or a dedicated MA for nurse visits, in addition to what they already have in a float role. So definitely a lot of great ideas. And you know, if we're going to be successful as an organization, it's going to take a team. The other quote that comes to mind, though, and hopefully everyone can understand this and sympathize with it, is there's always more good ideas than there is resources to execute them. And so, you know, we're going to do our best to do every good idea that we possibly can. But sometimes we have to just settle for doing and executing those great ideas. Even some good ideas have to sometimes get set aside for another time. So thank you so much for your participation today. Really excited to end our year on a strong note. Merry Christmas to each one of you. I hope that you have a fabulous holiday. I'm excited to bring in our new year, to make new resolutions, and to celebrate at our winter party. Dr. Loki was an advocate for a belly flop contest that I start. I don't know that we'll pull that off, but sounds like a lot of fun. Have a great day. Thanks for your participation, and have a good afternoon.